Welcome back. A new study out claiming dozens of hospitals across this country are price gouging some of their patients. Now, according to the study published in the journal Health Affairs, 50 hospitals are billing uninsured patients more than 10 times the cost of patient care as set by Medicare. Now, the researchers break it down this way. When a treatment costs a hospital $100, some hospitals will charge the patient $1,000. The study points out a typical U.S. hospital charges 3 times the cost. NBC News has not independently confirmed the results of the study, and some hospitals say it's not an accurate measure of what people pay. The group that operates half the centers on the list tells MSNBC, quote, "These charges rarely reflect what consumers actually pay for their health care. All hospitals affiliated with community health systems offer significant discounts for uninsured patients and charity care for those who qualify." Joining me now is Jean Rose, co-president of the National Nurses United, a union and professional association that conducted a similar study. Thank you so much for joining us, Jean.
You're welcome. I'm glad to be here.
Absolutely. It's pointed out you were not a part of this study that was just released this week, but as I mentioned, your organization did something similar here. Combined with the research done with your group and what you've read, does any of this come as a surprise to you?
No, not for any of us that are nurses and have been nurses for some time. It's, once again, the people that are the most vulnerable are having to pay more.
And it is interesting, to your point, that this study or allegations like this have been around for many years. I remember even, seeing, evening news reports where a Tylenol, for example, would cost 10 times more than it would if you simply had gone into, the drugstore to get it, as opposed to getting it when you went into the hospital.
That's true. And I think what we see happening is we hear all the stories about, as CHS has said, that doesn't really reflect what people are paying. But honestly, why charge exorbitant prices and then say you'll give some sort of a discount in the end? You have to believe that when they charge those high prices, somebody somewhere is paying them.
And to your point, the statement that we received from the health system, community health system, which is a part of most of the hospitals in question in this report, they explain it as there are discounts offered to the uninsured and charity care to those qualified, but there does not seem to be an actual explanation of why the cost is upticked in the first place.
Well, I would say because they can. There's only 2 states that regulate it. That would be Maryland and West Virginia. And in those states, they have a state agency that sets the highest markup that is allowed by those hospitals. And without that, you have no controls. You have a monopoly. So if nobody says you can't, they can, and they do.
And to your point that there is not, and I think people would be surprised that there are not laws or regulations in place to protect you from the price gouging that's alleged, if true.
It is. And it unfortunately hits people that, for example, things you wouldn't think of, like your auto insurance and your policies, your homeowners policies, things like that. What ends up happening is in states that where these hospitals charge those exorbitant rates, those policies are higher also. So what is most important to nurses is we see that our patients and families are affected by bankruptcies, and the worst is they will avoid medical care entirely.
And this study comes, of course, as you know, and your organization has talked about it as well, transparency that you believe is needed, and that seems to be the first component or the first major thing that could perhaps prevent this from happening.
That transparency is essential, and it needs to be regulated, because when you are ill, that is no time to be shopping around, even if the information were available.
Jean, thank you so much for your time. We greatly appreciate it. Again, your organization did a separate study, but with similar results as the one just released. Thank you so much for your time.
You're welcome.